everybody, welcome to the Thrive Ahead YouTube channel. Today we are interviewing two of our fabulous physical therapists at our Thrive of Lake County location, and we're going to talk about our wound care program. So ladies, can you give us some insight as to the wound care program for the Thrive Personalized Medical Rehabilitation Centers, and just basically some things that patients and families commonly ask questions, and the services that we provide?
The great part of a wound program in this facility, in our facility, is that we have a multidisciplinary approach to wound care. It's not only changing the dressings, but a very high involvement of a physical therapy department to cooperate with the wound healing, as well as the weekly visits by the wound physician. We work very closely, and it depends on the wound. We see patients 3 times a week or every day. And if the wound needs to be changed more often, of course the nurses are qualified to change the dressing anytime it's if it's gone, it's not present on the wound.
What are the types of wounds that you see on a regular basis, and most often from the hospital, and what are the types of conditions?
Well, I can see that we've seen all kinds of wounds in our facility, starting from the pressure sores, different stages, going to lacerations, skin tears, surgical wounds, abrasions,
venous stasis ulcer,
stasis, arterial, venous, diabetic, amputations, everything. So we treat them, and if they're appropriate, and they qualified for starting the physical therapy treatment, then they are referred to therapy, and they start a treatment, including...
We have multiple modalities that we can use based on the wound type, and what the doctor and the wound care team deem is appropriate, and based on any contraindications, based on the patient's medical history. But we do diathermy, we do electrical stimulation, and we do the ultramist treatments on them. And depending on the treatment that's being provided, it can be anywhere between 3 to 5 times a week. And it goes on for as long as we're seeing improvements in the wound. And sometimes we start with one and we'll switch to a different modality to help jumpstart the wound again after it starts to stall with the healing.
What are some commonly asked questions by patients and their families who are dealing with wound care needs?
Usually the first question is how bad it is. And after we treat them, of course, when the doctor comes, we do updates on it. If the family requests a phone call to talk about the wound, we talk about it. If we don't work with one treatment for one patient, as long as the treatment it helps and it's healing the wound, of course we're going to continue. But every week during the rounds, we make sure if the wound is not healing, what is the reason why it's not healing, and maybe we should change the treatment. So this is the greatest thing, that we don't have an order from the hospital and we just continue with that order. We assess and change the approach as needed on a weekly basis. And sometimes when the wound is not doing good or doing great or it's gone, we are in a constant communication with the primary physician, with wound physician. They are excellent with returning calls and coming as needed. So the families usually are updated. Sometimes they have a question, said, listen, my mom or my dad has a redness or a rash. Can you come and look at it? So this is a great thing to have a wound team almost every day in the house, because you don't have to wait for dermatology appointment. If it's something simple, sometimes we do have to refer to podiatrist, to dermatologist, to sometimes even a cancer or something. So we do have to approach that way. But most of the time, we go and check it out and talk to the doctor, and it's done almost right away.
How do you prepare patients with wounds for going home? So let's say that they've kind of fulfilled their purpose here at Thrive. What are some, preparations that we put into place to get people ready to go home?
So before they go home, we know if the wound is closed or it's still continue requiring wound care. Most patients go home without the wound, but if they go with the wound, we send them with a request for wound care clinic, or they already have set up appointment with the wound doctor to see them on the weekly basis. Usually we also make sure patient is going home with appropriate device like sitting cushion, bed, a mattress, the one they needed, because not everybody needs really high expensive air kind of devices. Sometimes just the simple gel cushions on the wheelchair. Of course, very important is education for the patients and family, to not to sit for a long time, not to lay down for a long time on one side, keep repositioning, keep walking.
Okay, so let's talk about the admission process. So when a patient first comes to a Thrive Center and they have wound care needs, how soon are they seen by the wound care team here at Thrive? And how often are they seen with additional support, such as a wound care physician? So what does that first 24 to 72 hours look like?
Before the patient comes in, usually the admission director lets us know if patient is having wounds which has to be taken care of, or whatever needs they have, we are aware of. All team in the facility knows. So if they in needs of a negative pressure therapy, which is wound vac, we order a wound vac ahead of the time. Sometimes we get them during the admission, sometimes it's a day later, but everybody knows the protocol of the wound changing dressing in every case. So the wound care is done as needed. Usually before patient comes in, the wound nurse changes the bandages in the hospital, so there is no need to address it the same day. But we have been having issue when they come from the hospital and the dressing is not present or it's gone. So we have to change it, and we address it and we assess it.
And physical and occupational therapy, as well as speech therapy, come in right away and do our evals within usually the 24 hours, if not less. And usually when we're doing, especially with the occupational therapy, they're doing ADLs, so they're looking at dressing, so they also see the skin. So if something else has come up, we do inform the wound care team as well to let them know if there's anything else that new or different since the hospital as well.
So if you were looking for a rehab facility and you have wound care needs,
I would say a collaborative team that involves not only a wound care coordinator, a doctor that comes around that specializes in wounds, as well as a physical therapy team that has the adjunct wound healing devices that we have. We have four separate modalities that can be used to help heal wounds if they qualify for them. And so just having that extra adjunct on top of it, on top of regular nursing, dressing changes and their types of things that they can use. So anywhere that can to add on, especially if it's a wound that's been present for a long time.
how does one qualify for the modalities for physical therapy for wound care?
So there are certain qualifications that the wound has to be a stage 3 or 4 for a pressure injury. It has to be over 30 days old, documented that they've had it for at least 30 days. And it has to have failed conservative treatment, so just regular nursing treatment in order to start modalities. Sometimes we can actually start earlier, especially if it's pain related. If somebody's having a lot of pain and it's limiting their mobility with activity, we can justify then doing treatments for pain, which can also then start to help the wounds healing.
Well, we really appreciate you being available for us today. And thank you everyone for watching the Thrive Ahead YouTube channel. And if you have any questions, you can comment in the comments section, or you can reach out to us at www.thriveahead.com. So thank you again and have a great day.